My sister first found out she had her first bout of breast cancer in 2004, and because she was what you would call the underinsured, she was on the Medicare plan or Medicaid plan, they did not do the preliminary studies that they would do with someone like myself who has privatized health care. They did not locate that she had cancer in her bone and that she had cancer in her adrenal glands. So therefore, once she received the basic care for her first round, her go-around with breast cancer, 3 years later she had a relapse, and at this point it was in every single organ in her body and had spread throughout her bones. In 2007, January, she had the cancer throughout her entire body. The unfortunate thing is when she left the hospital, once again she was on Medicaid. They did not do anything but the basic that they had to do. She was not sent home with any kind of information, well, where do I go from here? So I not only became her caregiver, I became her social worker. I got a hold of cancercare.org. They helped give her counseling over the phone. They got a hold of charitable groups that also did some counseling for her 8 children, who ranged from ages 12 down to 3 years old. And then she had 2 older kids that were grown, but they didn't need the counseling as much as the younger children did at that point in time. And throughout the entire fight, nobody seemed to tell us anything, what to expect, where to go, what kind of services were available to us. So it was basically a hunt for services and what we could do. Not only was I grieving the loss of my sister, but then I also had to become her house cleaner, her financier. I had to make sure all her important papers were in order because they only gave her 2 months. By the grace of God, she made it 8. And the unfortunate thing was that all of this could have been avoided had they simply done the bone scan after the first bout of cancer in 2004. I would still probably have my sister. However, she was not given the opportunity to have any extension in life because she was simply a cost. Her life was cost prohibitive. It was easier for them to let her die, in my estimation, than to give her the quality care that she deserved. A mother of 8 children should have been thought of more as a human being than a dollar in that essence.